We are here as part of an initiative that brought together She collaborates from Maastricht University, World Physiotherapy, the Masanga PT Teaching School, and it's an initiative that is funded by NAFIC. And the aim of this project is through a set of activities to help advance the physiotherapy teaching in the Masanga Teaching School. And as the World Confederation for Physiotherapy, we are responsible for the physiotherapy part, which is one of the three activities that are in this project. The first one being enabling learning, the second one being teaching in works places. As World Physio, we are responsible, or well, we were responsible for the physiotherapy content and the delivery of this training.
This is the very first physiotherapy training program in Sierra Leone, and as a very first physiotherapy training in Sierra Leone, and to be specific in Masanga, here we have what we have here is Masanga used to be a nurse-based training institution. So bringing in physiotherapy was a very totally new thing that we brought on the ground. So for us to really move from, say, a nursing training institution to having to deal with some physiotherapy services and the like, then so there was need for us to actually expose the students, expose the existing staff to what exactly physiotherapy is, so that they will learn and appreciate exactly what, when we speak about physiotherapy, what we're talking about.
My experience has been quite great and awesome because, luckily for all the physiotherapists in Sierra Leone, I have been coming to them. When you had your tanker explosion, I was part of the team to come and support physiotherapy at Connaught Hospital. I had a great experience with all the students back a year ago in Connaught. So for me, I think coming back to be able to see how much they remember of what we did has given me such a great insight as to how much value of students we have in Sierra Leone, whom we can mentor and continuously mentor to get the best out of them.
So my topic was about neurology. So I went onto the stroke patient, and then I tried to take the Sierra Leone physiotherapists with me to really understand what it is you can do with the stroke patient. The possibilities are endless, and how you can facilitate the stroke patient into his recovery.
I think that a lot has been achieved in the short time that you have had this school, but that also means that there's still a lot of challenges and a lot of different things. But I have great hopes that this first group of trainees will also become the teachers of the future generations of physiotherapists, starting, I hope, with a buddy system. So if they can be teamed up with the new students that will be starting, they can help those students during their studies, and then also later supervise them.
So my recommendation would be to advocate for it to be part of the major healthcare system, and for more physiotherapists to be trained and to be empowered to see more patients that really need it, and to, by that, mitigate disability and make sure that more people are able to participate in society and in their communities as well.
So in the last 5 days, we've put together people who have their own specialty in physiotherapy, and we've been trying to impart some clinical skills onto them that they will use to practice wherever they find themselves in the clinical areas within the country. So my experience is that the feedback they have given us is actually very positive, and they found it very useful. Of course, they also told us areas where we can do better. And then if somebody has to come and do a similar thing, or we have to come back and do a similar thing, there are lessons we have learned that we can use to make it better than what we have done this time around.
It's a very good feeling, to be sincere to you, because as we already know, TDCHS, which is Tonkolili District College of Health Sciences, is the only healthcare training institution that is actually training physiotherapists in country. And it's a big challenge, to be candid to you. And, but we'll try our level best, because it's nice for you people to know that we are having experts from different parts of the world who are coming in to boost this training, because we are not enough. We need extra people to come in and help out with what is happening out in Tonkolili. And this is the second of the boot camp we are having. We have a 5-day boot camp, which started Monday and is ending up today in physiotherapy for both lecturers and students. And this boot camp is it's like a continuous professional development on activities that has to do with propelling the training of physiotherapy in the country.
In my own personal view, I think it is a pleasure. It is a great opportunity to have people of this caliber to come and impact knowledge in us. And we've learned a lot, because whatever our tutors have taught us earlier on, this is an added opportunity, because we have professors, doctors, and masters who have experience for over 15-20 years. So for these people to come and impact knowledge on us, I think it's a blessing to us. And we are not taking it for granted. We appreciate the administration. We appreciate all the coordinators that made it possible for us to be here today.
It's awesome. A lot of difference I see, because we were garnered through the training by very smart and experienced colleagues from other countries, 8 consultants in all. So the programs we are well compressed and well in place, and it has enabled me to be able to practice very well as a clinician, but also to be able to pass on knowledge to students who are in the Tonkolili District College of Health Sciences, especially in the physiotherapy program.